To date, the Philippines has one of the highest per capita burden of tuberculosis in the world, with 500 people affected per 100,000. Pulmonary tuberculosis remains to be a leading cause of death in the Philippines in the last 5 years, placing 10th as the leading cause of death in the country in 2022. Challenges to accessing tuberculosis care include a growing distrust towards the public health system, the perception that private care is better care, and the high out-of-pocket costs in private medical care. To explore this further, the Social Innovation in Health Initiative conducted research on an innovative solution that has been providing sustainable community health and quality health services to effectively combat and overcome this persistent health threat. Using an intersectional gender lens, CHI explores these intersections that are crucial in addressing disparities, working towards equitable outcomes where every person, especially women and girls, have access to quality health care. Kalinga Health is an initiative founded by Innovations in Community Health, or ICH, which focuses on providing medical care, especially for vulnerable communities within Metro Manila. Kalinga Health is a 360-degree facility that utilizes a hub-and-spoke social enterprise model to conduct consultation, diagnostics, treatment, case holding, and follow-up for patients with tuberculosis.
So we are a hub, and our spokes work connected with different private practitioners, so they're able to refer patients to us. But the primary care still remains to these doctors. So we are able to access resources from the government, such as free gene expert testing, 6 months of medication, X-ray screening, and transfer it to this facility. And through this facility, we are able to transfer it to the patients of the private doctor. So these indigent patients can avail these services for free or very little cost.
Yung nag-i-impact ng Kalinga, siya yung facility na yung tao, hindi na mag-aalinlangan na pumunta na magpagamot kasi wala na yung pila, wala na yung stress sa paghintay ng result, aasikasuhin ka pagpunta dito, pa-follow up ka ng maayos. Kung may Kalinga Health or kung may mga ganitong program, kahit sa isang municipality, may isa lang, siguro hindi ganun kahirap sugpuin yung TB.
42.9% of the population in the Philippines with active TB are people living in slum areas, which is part of why Kalinga Health is committed to providing care for those from Metro Manila's most vulnerable sectors and communities.
Mga 2015 ba po, nararamdam ko sa sarili ko kasi maghapon po ako bibiyahin tricycle, inuubo. Konting lakad ko lang, hinihingal na po ako. Tsaka hindi ako makapagbuhat na mabigat, parang wala kang lakas. Sabi ng anak ko, doon ka na lang magpa-check up sa Kalinga, kasama kay mama. Maganda po yung palakad nila sa mga pasyente, tsaka mga alaga sila kapag nauubos na yung gamot.
Ang ginagawa ko po sa kanya sa madaling araw, nilulutuan talaga ng pagkain kasi hindi pwedeng hindi healthy yung pagkain na kinakain niya kasi nagagamot nga po siya.
Assisting Kalinga Health is a group of volunteers called the K-Leaders who use a more hands-on approach to identifying and referring cases from local areas. The K-Leaders serve as intermediaries who bridge the clinic to the communities it serves, creating a communication line and support system that allows its members to trust Kalinga Health with their medical care.
Pinupuntahan po namin, kinakausap namin po sila, tinatanong namin kung inuubo ba kayo or sinisipon, kung ilang araw na ba, ilang linggo or ilang buwan. Kaya, ini-encourage po namin sila magpa-consult dito sa clinic. Karamihan po kasi doon sa community, yung mga patient po doon, kunyari, yung mga inuubo, sasabihin, wala yan, ganyan. Pero minumulat din namin sa kanila na kailangan talaga nila magpa-check up.
Tuberculosis affects more men than women, and inversely, Kalinga Health's K-Leaders are often women rather than men. Women are traditionally viewed as caretakers of their families, and the responsibilities of a K-leader asks that this role be expanded beyond the home and into their larger community.
May edad na rin po ako. Iniisip ko ano kaya mag-retired na ako. Pero hindi ko rin maisip yun kasi parang nananaig pa rin yung mga patient na yung mga nag-i-stop sa gamutan. Lalo na po yung mga kabataan na hindi nagtutuloy ng gamutan.
Kalinga Health's community-centered approach takes into account the Filipinos' desire for collective interdependence, which allows healing to take place on a community level. Much work still has to be done to make the vision of a TB-free Philippines a reality. But if initiatives like Kalinga Health, which highlights the importance of active participation of communities in crafting a human-centered solution, are given the resources it needs, then there is a strong chance that people will be able to receive the care, support, and community they need.